Welcome to Module 2, Examining the Evidence. My name is Dr. Miriam Zavala.
Hello, welcome. I'm Dr. Renae Schumann.
The learning objectives for this module are examine workforce diversity, explore social and demographic factors that may influence NCLEX outcomes. Third, examine the NCLEX pass rates. And lastly, explore high-impact educational practices and academic success. The Sullivan report cites that the health profession have not kept pace with changing demographics, and that may even be a greater cause of disparities in health access and outcomes than the persistent lack of health insurance for tens of millions of Americans in 2004. They go on to say that there is a correlation between the shortage of minority health providers and health disparities in the minority population. They say that diversifying the healthcare workforce will improve the health of the entire nation. The American Association of Colleges of Nursing have said that nursing leaders recognize a strong connection between a culturally diverse nursing workforce and the ability to provide quality, culturally competent patient care. Healthy People has spoken with saying that when patients and families receive health care from professionals who share their racial or ethnic background, improves health outcomes. And lastly, Ackerman Barger in 2020 also concurred with the Sullivan report in saying that minority providers are more likely to practice in underserved communities. Thus, the consensus is that diversifying the healthcare workforce will reduce health disparities. Looking at social and demographic factors of Hispanic nursing students, we need to keep in mind that about 60 million or about 18.5% of the US population are Hispanic Latino, according to the Census Bureau. They define being Hispanic is a person of Cuban, Mexican, Puerto Rican, South or Central American, or other Spanish culture or origin, regardless of race. Now, when we look to registered nurses, there are about 3 million of us, but only 3.6% are Hispanics, which this does not mirror the percentage of Hispanics in the US. Lamas et al. Stated that Hispanic students who are acculturated into the mainstream culture while simultaneously living with families that have different values may be criticized by their families, which may then negatively impact their nursing school performance. Choi also examined the concept of cultural marginality. And Choi says that the data suggests that Hispanic BSN students experience a process of acculturation even before they start their nursing programs. While in nursing schools, the Hispanic nursing students experience marginal living and cross-cultural conflict recognition. Dusher and Cowing, when they looked at that concept, they said that it occurs when an individual lives simultaneously between two worlds where the borders are seen as being mutually exclusive, opposed, and permeable. Alicia Plana said in 2008, she talked about the concept of bicultural lane. She sees it as a sense of prevailing family obligation felt by the students, and it is very much part of their cultural heritage. Factors that may influence acculturation can be age of joining the new culture, length of stay, language proficiency, ethnic identity, social economic status, and immigration experiences. However, there is a paucity of evidence about the student's language fluency, if the student was born in the US, first-generation college student, or if the nursing student belongs to more than one underrepresented group, such as being Hispanic and being male, according to Woodley and Llewellyn in 2018. As far back as 1997, Mayville and Huerta suggested that the students' responsibility to their family impacted their ability to be able to continue in their nursing programs. And what's interesting is that nurse educators must consider that nursing itself is a culture. Chris et al. In 2017 defined mentorship as a relationship in which a more experienced or more knowledgeable person helps to guide a less experienced or less knowledgeable person. Cruz in 2009 and Jacoby in 1999 identified 4 elements in a mentorship relationship. One is that the relationships are focused on growth and development of the student. Mentoring experiences may include professional guidance, career support, and emotional support. And they said that relationships are personal and reciprocal. And lastly is that relative to their students, mentors have more experience, influence, or achievement within their educational environment. So the significance of mentoring, the value of mentoring. Betting and Backer showed that across many universities, those students who were mentored were more likely to persist to the second year of college. And Chris et al. Stated that they conducted a literature review, and those articles suggested that mentoring is positively correlated with academic progress, persistence, and degree completion. And the students' perception about mentoring, these are just 2 citations, but there are many more. Sidney and Griffin stated that students who were treated kindly and respectfully and who felt supported within in-person meetings helped them feel connected to school, which led to program completion. Kennedy et al. Said that learned from their study that face-to-face presence in mentoring led to the better engagement with mentees and promoted program success. So mentoring is very valuable.
Thank you, Mirian. That was very informative. We can see that there's literature in this area, even though there's not very much, it is very consistent. Some of the things that I'll be talking about now include NCLEX success, especially with this student group. As was previously stated, Hispanic students have strong family responsibilities and strong family ties. It is not unusual for family to have needs that take priority over school or over testing or other factors which might contribute to success or inhibit success. It's true with any student group, but especially in a group like this with very strong family ties. It's not a surprise, but it is a sad thing, and we can possibly work to create better circumstances for these student groups. Woodley and Llewellyn did 2 studies back to back where they were looking at literature review of Hispanic students and new graduates' experience in nursing school. They found a number of things, and as was stated previously, they used choice theory of marginal living to discuss their findings. And as Dr. Zavala said, these students were found to be in marginal circumstances where they were in between, or they were poised in between 2 separate cultures. The culture that they were born and grown up in the Hispanic culture, and also the culture of the majority of their classmates in the culture of nursing school. As she stated previously, and as we probably all noticed, nursing schools and nursing students do have their own way of life and their own culture. And if it's not congruent with the upbringing of the student, it could cause quite a bit of conflict. They found that in their first study that Hispanic and Latino students can feel isolated, they can feel lonely, out of place, and very anxious because of all these things. Because of their loneliness and their feelings that they don't belong, they have a higher attrition rate than the majority group. What they couldn't determine from this literature, from the literature review, is why there was a higher attrition rate than the majority group. So maybe you know, and maybe we can discuss that at the end of this presentation, why you think, what the reason is for this with this population. In their follow-up study, where they were doing secondary analysis, Woodley and Llewellyn found that Hispanic students can have negative results from the stress associated with cross-cultural tension. The negative results can include having to leave nursing school, leaving the profession, not being able to go back at all, or if they do finish, they could fall into the circumstance of not passing NCLEX the first time. But one thing that we do know for sure is that we need more literature and more research on this population, because even though Dr. Zavala and I are able to present some things on this, it's not nearly enough to know exactly what's going on. There are some high impact practices associated with mentoring. There are some formal ones and some informal ones. Most of the literature sources that we reviewed point to one of or more than one of these particular features that are on the screen. There are learning communities. Learning communities can be faculty-led or they can be student-led, but they have commonalities of either being in the same course or the same demographic or maybe they live in the same neighborhood or they have some other commonality which draws them to each other. First year seminars is one of the things that my school, Houston Baptist, does. First year seminars where they can be assigned a mentor. Being assigned a mentor or being assigned into a learning community, these are more formal processes which can require applications. Application where the student or the one who wants to be mentored or the protege completes an application and submitted to an overall body or a board, or maybe just to one faculty person. And then the match can be made between the mentor and the mentee. There are several professional organizations that do the same thing. Like the American Nurses Association has a similar process for its very large number of new nurses and more experienced nurses. There are several schools who do this within their nursing student associations. We'll talk about that in just a few minutes. There are mentoring and mentee experiences with common intellectual experiences. Maybe they're in the same honors program, or maybe they're in the same research class or some other common thing that they have together that they can share and draw them into more relationship. Because that was, as was stated in the definition of mentoring, it's about relationship. It's not necessarily just advising or just meeting with. And as we have seen, and we'll see again, that it's better when it's face-to-face, if possible. There are telecommunications, telehealth. These are big in the healthcare world right now, especially with COVID. And it's not unusual for schools to do all their advising right now or their mentoring through Zoom. I know that we're having to do that. I have several advisees that I'm Zooming with, but it's not the same as being able to see the reactions and be with them and know the whole experience that they're feeling. I mean, I can see, as long as we don't have any fuzzing out of the screens and nobody freezes or whatever, I can see how what I'm saying to them impacts them, but not nearly as well as we can if we're face-to-face. And I can almost feel whatever emotions that they're feeling at the same time. Service learning and community-based learning are very important ways of setting up mentoring processes, as are internships. Nursing is getting very good about internships beyond the clinical experience. One of the schools in the Houston area, where I'm from, one of the schools in the area has their entire final year of nursing school is set up with like one big internship where they have all the didactic front loaded, and then they have all the clinical experiences backloaded, and the final semester is almost all clinical. Well, that's easy to set up mentoring programs that way, because they find someone and they are able to not so much latch on, but connect in a more meaningful way as the mentor can follow their progress through clinical, and it really does help them complete the program. It helps them be motivated to finish and to do well on NCLEX and to actually be able to get a job there, and all those are very positive things. We've all heard of the faculty shortage. We all know that it's common for the nursing faculty demographic not to match the student demographic. We also know, as we've seen in the literature, that peer mentoring is a huge concept. It's something that's very, very successful. And so, according to Stone, Cooper, and Kant, mentoring is a peer learning strategy, can be, that where demonstrated properly can improve a student's skills in critical thinking and their self-confidence and their communication. So lest we get into a discussion of what critical thinking actually is, more than we know it when we see it, we do know that if a student or someone who's maybe a semester, maybe a year ahead of a mentee can say, well, for example, this is what I would do about this, or I would refer to this, or I would put all these pieces together and come up with this, because that student has had the experience doing so. He or she can influence greatly an incoming student or someone who's less experienced with school. Peer mentors can facilitate professional growth among students. There's nothing like having a role model who looks like you, having a mentor who looks like you, who has some of the same experiences that you have. A peer mentor, someone who's still in the program with you, still relates. So as a nursing faculty, as a dean of a nursing school, I've seen a number of times where I've seen some of my students who graduate and they say, when I get out, I'm never going to forget what it's like to be in nursing school, so that when I'm in the hospital and I have a student with me, I won't be mean and bad to them or eat my young like I feel like was done to me. Well, I always want to hold them to that, because that's a big deal. Not forgetting that you're in school, not forgetting what it's been like as a student is huge. So when they're still in school and helping one another, that is the biggest asset that a community like this can have. At the University of Texas Health Science Center at San Antonio School of Nursing, they have a program, Juntos Podemos, meaning together we can. This program facilitates a mentor-protege relationship among the students to prepare Hispanic nurses to serve in the underserved areas in the San Antonio and Central Texas area. At Houston Baptist University, where I am, our Nursing Student Association has a PALS program where senior students are matched together. They are matched demographically when possible. They're matched according to any other details that they may have, whether or not they came from the same high school, or they live all in the dorms, or they're all in the honors program or whatever, but demographically they're suited together. And so the senior students can help the junior students not know what's on the test. That is not the purpose of it. And I know that a lot of junior students hope that that's the purpose. That is not the purpose, to know what's on the test. The purpose is to know things like how to best do time management, how to not necessarily navigate a particular class, but know the best ways to be successful in classes. And we now have not just the PALS between juniors and seniors, but we have a pre-nursing PALS moderator who sets up junior, senior students with freshman, sophomore students who are considering nursing school to help them know what's needed to be accepted and the best ways to manage all the prerequisite content, all those sciences and things like that. So it's been very effective, and it's helped our enrollment and our retention very much so, in having these PALS programs. According to Jacobs and al., peer mentoring programs contribute to student success, as we've been saying, and they recommend that mentorship programs be embedded in nursing curriculum. We have a lot of nursing curriculum as it is, but we see from our literature here and from our evidence that mentoring is worthwhile, and it's something that should be included in some way, some shape or form. I'm wondering if anyone on this attending has some ways that they've included it in their curriculum, and we would like to be able to discuss that hopefully at the end. McBride, Campbell, and Deming found that, and this is a direct quote, effective mentoring begets effective mentoring. So if you were mentored well coming up, you learn the techniques of mentoring and you're able to pass them on. I did find that to be true in my own practice and my own education. I had two very strong mentors who were very much like sponsors. In fact, one of them, when she was promoted or had something really great happen to her, she had me by the hand and was pulling me up with her. And I asked why. I was grateful. I asked why, and she said, because that's how we progress the profession. We find people to help, we lift them up, and we carry them on alongside us, because who's going to take over leadership if we don't bring some up with us? And this is true when you are mentored that way, you can also mentor others. And I'm not going to try to make everybody feel this is your duty, but I will say it's something that's been very beneficial as I use what I learned from being mentored, as I mentor students and other faculty. Hickey and all found that when you have a class such as a research class and you want to mentor in it, you need to promote a positive environment for mentoring so that it can occur. So then the students want to be mentored and they want to learn from that. And it's beneficial for not only the students, but for the mentors too. And so that positive environment includes participation by both parties, not just the student, but by the mentors as well. It includes community, meaning getting together, not necessarily just over the phone or Zoom, but when you don't have to worry about the distancing so much, having some community. And things like prior learning from both the student and the faculty, what they have learned together and what they can share, the motivation to be mentored and to mentor, and the technology that's used for that. Technology is especially important when you're doing things like mentoring someone how to be a nurse. Technology is very important with that. Even technology and mentoring communication is really, really big. In these days of, as I mentioned earlier, telehealth and telecommunication, not meaning to go again about my own experiences, but recently I did have surgery and the entire follow-up was done by text message. I never saw the surgeon again after seeing him in the recovery room. I sort of saw him, I was still out of it. I never saw him again, except for, and I saw him through text message, and it turned out okay. But I think probably if he were going to be my mentor, I would want a little bit more in the relationship than that. Nelson in 2019 stated that the atmosphere which promotes faculty and student mentorship is critical for students, and it helps them feel acknowledged and confident. Mentors can role model, they can enhance leadership skills, both the mentor and the mentee's leadership skills, and they can provide the mentee with a sense of belonging that they may not have because of feeling like they're stuck in between two different cultures. As I said earlier, we do need more evidence to support this population. And so I welcome any discussion that you may have on things that could be published, things that you're doing in your schools that we could talk about and contribute to this body of knowledge. Thank you.